Video 3. Biomechanics of the pelvis. The phrase biomechanics of the pelvis sounds somewhat antiquated, as we're much more used to talking about the biomechanics of the sacroiliac joint. Although this is fine as a starting point, the pelvis is a closed mechanical system, and its movement as a whole is far greater than the sum of its parts. I believe it's essential to talk about the pelvis as a whole, not just from a biomechanical point of view, but also as the basis of assessment, diagnosis and treatment. The movement of the sacrum is described as nutation and counter-nutation. The sacrum can nod forward, which is known as nutation, and tilt backwards, which is known as counter-nutation. Pure nutation occurs while standing, where the weight of the torso falls in front of the sacroiliac joints and induces rotation of the sacrum, where the sacral base moves anteriorly. Pure counter-nutation only really occurs when both hips are fully flexed, e.g. when bending down or in the fetal position. However, these pure movements do not occur on both sides during ambulant movement. In fact, one side nutates as the other counter-nutates. From the perspective of the innominate, the equivalent of nutation is posterior rotation, and the equivalent of counter-nutation is anterior rotation. During ambulation, one side posteriorly rotates as the other anteriorly rotates. Studies of the center of rotation show numerous possible axes. These axes can appear to be posterior as well as anterior to the joint, as well as within the joint itself. The reality in ambulation is likely to be a shifting axis during different gait stances, coupled with significant variations between individuals. In this model, CR represents the center of rotation of the sacroiliac joint, and the black stars represent where there is joint surface proximation or locking. If you look at the top three illustrations, you can see the center of rotation varies from anterior to the joint, to the center of the joint, to posterior to the joint. At the same time, the joint surface proximation shifts from the lower pole to the whole of the joint to the upper pole. At the same time, the reverse is true on the other side. When we couple the two sacroiliac joints with the pubic symphysis at the front, posterior rotation on one side is accompanied by anterior rotation on the other side. In other words, the ambulatory mechanics of the pelvis involves two opposing movements, creating a cyclical movement of torsion. I want to present the following as a simple model for visualization. I think the ambulatory movement of the pelvis is best visualized using your hands. Imagine you're holding a large bowl in your hands. Join your little fingers at the front to represent the pubic symphysis, and leave a gap of 10 centimeters between your wrists. Now imagine your first metacarpals are the sacroiliac joints, and the sacrum is sitting in the gap between your hands. Now start to walk your pelvis. Posteriorize the left hand while anteriorizing the right, and then do the reverse and repeat in rhythmic fashion. When this feels comfortable, imagine the movement of the sacrum between your first metacarpals, rather like a spinning top, gently derotating as it slows down. If you think of your first metacarpal as the iliac portion of the sacroiliac joint, you may also begin to get a sense of the opposing poles of joint surface proximation at extremes of torsion. Now focus on the sacral base. Although in reality the base is tilted anteriorly, we can visualize the sacral base as the upper part of the spinning top as it derotates. This movement of the sacral base will be directly transferred to the body of L5, and hence the ambulatory movement of the base of the lumbar spine. This movement of the sacral base is directly transferred to the body of L5, and hence the ambulatory movement of the base of the lumbar spine. The handle of the spinning top can be visualized as the axis of the movement of the body of L5. Each intervertebral disc would dampen the movement as it travels upwards. We can now imagine how the pelvis might move when there is inherent torsion. By far the most common torsion is when the left innominate is posteriorized and the right innominate is anteriorized. Hold your hands in this position and now start to walk your pelvis. Now focus on the sacral base and its influence on the foundations of the lumbar spine. Observe the spindle of the spinning top as the axis of the center of the lumbar spine. Primary movement of the ilium on the sacrum is described as posterior and anterior rotation, and this is usually ascribed a value of 2 to 4 degrees. However, when combined with the movement of the pubic symphysis, the amount of torsion in the pelvis is much greater, and from observation, the sacrum can deviate from the vertical by at least 20 degrees.